Bell Let's Talk Day is this Wednesday when Bell will donate 5 cents to mental health programs for every text, call, tweet, Snapchat, or Facebook post that mentions Bell Let's Talk Day. It's also a day that we can focus on mental health. And joining me now to talk about issues affecting kids ages 4 to 18 is Tania DaSilva, Clinical Director and Lead Therapist at Behaviour Matters in Toronto. Thank you so much for coming here and spending this time with us, chatting with us about this. So we know as adults, I feel like adults find the words easier to say, yes, I'm suffering from something, or I'm dealing with something right now. What about kids? What kind of issues do they deal with?
So for us, what we see a lot is kids come in and they're basically just talking about the academic pressures that they have, the overall expectations that are put on them. Peer issues comes up a lot, the struggle there, the lack of social skills, the not knowing how to interact in social situations, as well as just lack of emotional regulation skills and low self-esteem. So that's what we see on a daily basis. So
what about for parents when, what kind of warning signs should they look in their kid to maybe offer them some of the help that they need?
So I find like there's always a category, right? So typically if you're noticing that your kids are starting to pull back from going to school or from like friendship groups and socialization, that's a big one. Changes in concentration, eating habits, and sleeping habits are huge. If you're just noticing a general, just like low level in mood, like that hopelessness, that's big too. Changes in how they're doing academically. So there's a lot of things to look out for there too, but even just noticing if their mood's changing, right? If we're seeing that emotional distress.
And you are the lead therapist, but you also have a team at Behaviour Toronto.
Absolutely, yeah.
So what kind of treatments do you offer for kids?
So, and that's the interesting thing. I find a lot of parents don't know what's out there for them as support. So for us, I mean, everyone typically knows about individual and family therapy, but we also offer online programs, school workshops. We have emotional regulation kits that are in schools or parents can use at home. So there is all these easy additional resources. One of our biggest things is our group programs. So going back to the social skill and emotional regulation piece, that's a big one for kids. We actually offer groups where they can come and they work on their emotional and social well-being. They learn that emotional language like you originally mentioned, and they typically have fun doing it, right? So it's creating that safe space for them where you need to learn this and it's okay, and normalizing the whole experience of it.
And you were mentioning earlier that there are 4 influencing factors for each person. What are they?
So typically genetics is a huge one, right? So always looking back at your family history. If someone does have a mental illness, then you might also have one. Brain chemistry is huge. The way we usually explain it to our little ones is sometimes you have too much or too little of a chemical, and that's why you're feeling anxious or depressed. Life events, so trauma, separation, violence, abuse, those big stressful life moments, that affects it as well. And the biggest one, going back to emotional and social skills, is that learned behavior. So if you haven't learned how to cope, or if you've learned negative coping strategies, then it's going to be difficult for you to manage your mental health as well.
So someone at home who's listening to us right now and wants to reach out, what's a good way for them to reach out to you and your team?
So they can reach us at info@behaviormatters.ca. We have tons of services, but again, if we can't help them, we'll refer them out to someone that can. So they can reach us and we can kind of work with them and kind of move from there.
Okay, thank you so much for that, Tania. Tania DaSilva, lead therapist at Behaviour Matters Toronto.